So I think chronic joint pain in itself is a whole different category. So I usually ask 4 questions. So the first question, is it really joint pain? And I think that's the one thing that people, both patients as well as providers, they may gloss over, because people say, well, my hip hurts, but it's really their bursa or whatever it is. And so you have to really focus in on whether it is the joint itself. Is it monoarticular? Is it less than 4 joints, or oligoarticular? Or is it a number of joints? Is it the structures around the joints? So the bursa, the tendinous and ligamentous insertions, those things can mimic joint pain in themselves. And again, there's also referred pain. And one of the examples that I love is the patient that comes in telling us that they have knee pain, where their knee x-rays are totally normal, but their hips are totally destroyed. And so referred pain from the hip, the compensation in the knees, people will complain of pain that's not related to the structure that they have complaints about. So the next question then would be, is it truly arthritis, or is it more of an arthralgia issue? And the simple definition is swelling will really define arthritis. Arthritis really is what establishes a true joint disease diagnosis. Arthralgias are symptoms. If my joint hurts, then it could be from arthritis, but it certainly is just a symptom we deem as arthralgias. The next question I would ask, is it inflammatory or is it not inflammatory? So the most important question you should ask is, does it get better with exercise? Does it get worse? Inflammatory arthritis in conditions like lupus, rheumatoid arthritis, psoriatic arthritis, or gout will get better with exercise. Inflammatory pain tends to cause morning stiffness that is greater than 30 minutes. Non-inflammatory pain will usually be worse with activity and may get better with early on movements in the morning. And the next question would be really focusing in on, is it inflammatory or not? And so I will hammer home the points. Is it better with exercise? Is it long-standing? Does it last more than 60 minutes? And those are the hallmark features of inflammatory arthritis. The next question would be, are there extra articular manifestations that should clue you into a systemic condition? And so there's a number of different things that you can delve into, usually found in their past medical history, or things that have become more prominent. And so, for example, if the biggest thing we should not miss are things like fevers and chills to indicate a septic arthritis. But if you have things that associate with a family history, such as IBD, then you should ask about their GI symptoms. But every situation is going to be different, and I think that you really have to look outside the joint in order to gain understanding about what's going on in the joints as well.
So those 4 questions, just to recap, are, is it in the joint or outside of the joint? Is it actual arthritis, or is it arthralgia? And the key difference there is swelling of the joint.
That's correct.
Is it inflammatory or non-inflammatory? And you gave us those great kind of questions to tease that out. And then finally, are there any extra articular manifestations of disease that can point us in one direction or another?
That's right.